The CME Excellence Dronacharya Award is presented to Dr. S. Natarajan, Chairman and Managing Director, Head and Consultant, Vitreo-Retinal Surgery Ophthalmology, Aditya Jyot Eye Hospital for exceptional CME efforts in ophthalmology. Congratulations, Dr. Natarajan. I request you to please say a few
Thanks a lot. Thank you very much, and thanks to the Omnicuris and IHW. I just read about on IHW about multilateral stakeholder and R&D in training, health communication, publication, and education. And I'm happy that I work with Omnicuris closely. And Omnicuris did a wonderful program. Before that, I want to tell about IHW. The reason is I believe in 100% patient satisfaction, education, and also to create awareness. Even though I'm a surgeon, vitreoretinal surgeon, but I wanted to prevent diabetic blind from India. So I'm making a program called Diabetic Blind Free India 2025 as an All India Ophthalmic Society past president, as well as I'm the president of Tele-Ophthalmic Society of India. And the idea is we want to reach all the villages, use offline artificial intelligence using the mobile phone. You can take a photograph of retina, and an ophthalmologist or an image grader sitting in Aditya Jyot or anywhere, or even a non-medical person can take this phone. That's what we have done training in all the slums of Mumbai. We have a MOU with the Bombay Municipal Corporation, MCGM, Municipal Corporation of Greater Mumbai. The idea is to screen every diabetic. So the special program specifically done by Omnicuris, and also working with Omnicuris from my All India Ophthalmic Society President days, where they are a CME partner for All India Ophthalmic Society, and we are the largest ophthalmic society of the world with 23,000 members, and Omnicuris is an official CME partner. But Omnicuris made a special program with me. Omnicuris, this is what I write to all my best faculty in the world, not only India. Omnicuris is India's largest online platform for doctors in collaboration with various state medical councils, has launched its first ever talk show for the ophthalmology fraternity, and exclusive on air with Dr. S. Natarajan, or Ophthalmology Air Show. And I wanted this to be a novel, interactive, informal chat show which makes learning more interesting and fun. And that way, we were in the middle of COVID, and I think every day I had 3 webinars all over the world. Thanks, I can see Soumya is laughing away to glory, because she's the one who is really most energetic person of Omnicuris. And I actually asked her, how does your the owner or the promoter of Omnicuris is looking after you? And I can see her 32 teeth now. Thank you. And I understand that the usual webinar format has become quite tiresome and boring for many people, and hence the conception of this one-of-a-kind multi-episode tete-a-tete, where I will have the pleasure of being the host and interacting with young, distinguished ophthalmologists of today. The most unique aspect of this show is that it's being conducted by Omnicuris, an online platform which assigns CME credit points for this talk show, which is great. We had a 1 CME credit. And we had started, and the important thing is anybody cannot log in. Like now we have FB Live, anybody can see. But this show, you have to be an ophthalmologist and you have to register, and you have to register, then only get in. And I think we aimed at 1,000 plus, and I'm amazed. Every time we had 1,000 plus attending and online. And apart from that, they have there in the YouTube. And we had started the first show of the series with a session on recent advances in ophthalmology on October 2nd, 2020, on Gandhi Jayanti. With our long-standing friendship, I'm very pleased to invite all the top ophthalmologists of the world. We did 1 Indian, and every 2 weeks one for foreign faculty. I can think of this is what we wrote, and the format of the show is that of a short video. That means we had 10 case presentations as a video and PowerPoint slide presentation, but I never encouraged slide, except Dr. Subba, who somehow said he cannot show video, but he showed but excellent slides on genetic engineering in ophthalmology. And at the end, there was a question answer with the audience, and a final rapid fire session, which viewers get to know the speaker. And it was nice, because I always imagined like a coffee with Karan, and here I actually wanted a coffee with Soumya, but she made me a host, and I'm glad. Otherwise, I usually give the bhashan and people listen. But here, I listen to them, I question them. In that way, Soumya made me do homework on 15 branches of ophthalmology. That means ocular oncology, oculoplasty, the dry eye, ocular surface disorder, and so on. And I think we had 15 subspecialties, and I enjoyed doing this. And I actually called her 2 weeks back, and I said, when are we starting again? Because the regular webinars are boring. And I think, I'm sure everybody, I even have a specific exercise, because all the time you sit down and your back muscles pain. So I don't have muscles also. That's my problem. So I'm now doing exercise to improve my back muscles so that I can sit and do it. And I have created a studio in the hospital. I invite IHW to be a partner, and also Omnicuris. And really, Soumya, I made an Aditya Jyot studio to make a lot of teaching videos, teaching snippets for the postgraduates, and also motivational talks, thanks to my daughter who has made it with a professional camera. And then also, maybe I learned from my life coach, Dr. Anamika, that you should even charge for the video. Maybe we'll partner with Soumya and make some CME credits. Once again, thank you very much for the Dronacharya Award. And I always dedicate my award to my mentor, that is Dr. Badrinath Padma Bhushan. I always salute my Mata, Pita, Guru, Mitra, and Deva. And without audience, what is the use of teaching? That means without students, no teachers. Without patients, we are not doctors. So I think IHW is an excellent platform, and an excellent platform for Omnicuris. And I congratulate both IHW. I can see Kamal Narayan sir is clapping. Thank you very much, sir.